Just going to take you a bit through the presentation a little bit more. I think it's really, really good that a lot of you are here today, because it is about us talking to you, about us listening, and about you having conversations with each other about getting some ideas to come back to us with some really strong bids based upon what Jane was saying. So as Jane was saying before, the Council and the CCGs, our main provider is Manchester Mental Health and Social Care Trust. We both fund the trust. We, the Council, which is where I'm from, fund to get that kind of social care response, and the CCGs fund around health. One of the things that we buy into are community mental health teams, which a lot of you will be familiar with and already working with. We have 6 teams across the city, and community mental health teams is where you will have social workers, community psychiatric nurses, occupational therapists. It's that multidisciplinary approach that provides health and social care assessment. And what we have within the community health teams will be people who will be giving advice, they're supporting with treatment, they're trying to make those local links. And what we know through, not just through the trust in our community mental health teams, but through all the provision that we fund, is that it is about that person's treatment and ongoing kind of interaction. It's their friendships, it's sometimes their isolation, it's that good physical health that they need, it's that access into volunteering that's really important. And that's why this grant is really, really important. So what I'm going to do is just take you through a little bit of some examples. Some of these are based on commissioner experience, some of it's based on feedback from providers, some of it's based on feedback from service users that we've merged together. I think in some of the later case studies will be specifically around individuals that have been through services. So what I want you to do is kind of take some of what you're hearing and place it within your organisation or your experience. So first of all, I'll talk to you about someone who has been in community mental health team and is stepping back down in the community. Don't expect you to read it, it's not going to be a test or anything, so I'll just take you through it. So Fred, been in community mental health teams for over 8 years, had years and years and years of being homeless and a variety of different issues, housing, benefits, as well as that mental health kind of issue. Fred had been into hospitals on a couple of occasions, 2 occasions in particular, where his physical health had really deteriorated. So I'm sure some of these examples you'll be really familiar. You'll have people in this situation. Physical health is a problem, mental health is a problem, and there are loads of surrounding factors as well. Fred, after his last hospital admission, had been working with someone in the community mental health team, his care coordinator, and together, through their assessment and their support planning, they looked at some of the options. And one of the options would be around trying to get what we call a personal budget, individual budget. It's basically the money you can get to purchase a package for yourself. And the package that was going to be the best place for Fred was to go into supported accommodation. Obviously, after Fred's experience throughout the years, he had been homeless before, he had been experiencing his mental illness, he was anxious. He was afraid, he was a bit upset, and although he wanted this for himself, he didn't know exactly what it was going to mean. So it did create some anxiety, and I think for Fred, it was about how was he going to kind of live and survive once he moved into this accommodation. Who will he make contact with? Will he have any friends? How will he live day to day? So I'm sure that some of this will relate to you. So where the grant could come in is someone, and I think it's really important about supporting Fred to do things for himself is the really key message. But someone who would be available to take some of those steps with Fred, someone who could go to that first interview around is getting his personal independence payment sorted. Someone who could help him work out the bus routes to get to and from places and what the local community connections could be. Someone he could work with who would help build his confidence, but also his links in terms of doing different activities and maybe eventually volunteering somewhere. He might even be able to build up to working and doing some of this for himself. But where I think the grant could come in really brilliantly, and for some of the work that I already know you guys do, is around the support to enable somebody to be independent for themselves. Sometimes it might be on a regular basis to begin with, sometimes it might be just a brief conversation that helps to make sure that someone is on the right track. But I think it's the support around these specific things